The World Society for Protection of Animals is warning that factory farming is laying the foundation for another antimicrobial resistance, which would lead to the rise of a superbug. The organization says that the use of antibiotics in factory farming systems has been linked to the antimicrobial resistance that then spreads into the food chain and general environment. Anita Nkonge is on that report.
The unprecedented pandemic that is COVID-19 has shaken the world as we know it. Its surprising emergence has transformed our day-to-day habits from work to socializing. But the World Society for the Protection of Animals is now warning that another superbug could be threatening the world as we know it: the rise of antimicrobial resistance. A report by the organization claims that the use of antibiotics in factory farming is laying the foundation for another health crisis.
When antibiotic is overused, what happens is that it selects out organisms which are resistant. And these resistant organisms then become a problem to public health because they cannot be treated, and if somebody got infected, they would have no recourse to get well.
Antibiotics are primarily used to ensure animals do not get sick or stressed, and according to reports done by the organization, 75% of all antibiotics produced globally are being used in factory farms. A WHO-funded study shows restricting antibiotic use in food-producing animals leads to a reduction in the presence of superbugs in these animals, which in turn is associated with up to 24% lower superbugs in the human population.
Farming needs to look at use of antibiotics to ensure that ultimately we are not having challenges with antibiotic resistance.
A 2020 UN report also found that intensive farming is responsible for more than half of all infectious diseases such as swine flu, bird flu and Nipah virus that have moved between animals and people since 1940. The WHO is also warning that the world risks having organisms resistant to all antibiotics and thus leading to a crisis in which common ailments may become dangerous and perhaps even impossible to treat. Anita Nkonge, NTV.